My best friend's mum suffered a stroke at the age of 52. She started forgetting simple things. She couldn't use her arm, she lost her job, and it took her 6 months to go back to her normal life. In the UK, a stroke occurs approximately every 3 minutes. This is the time it takes me to give you this presentation. Importantly, it leaves patients with a long-term disability with little medical offer. So in the days and weeks and months after a stroke, one component that dynamically changes is the immune system. My research focuses on a population of immune cells known as brain-associated macrophages, or BAMs for short. They are located on the surface of the brain as well as surrounding brain arteries. Their functions in brain diseases are somewhat enigmatic. In Alzheimer's disease, they're known to scavenge faulty proteins, but in people with high blood pressure, they're actually causing dysfunction in the brain circulation. What do they do in stroke is a question I am trying to answer. Imagine that you live in a castle surrounded by a moat. In the moat, there are crocodiles patrolling the waters and ready to neutralize anyone who dares cross. One day, the castle comes under attack. The outer walls start crumbling, allowing for intruders and crocodiles to come in. Now, you might think, this will be the end of me. Either the intruders will kill me or the crocodiles will eat me. However, the crocodiles are also able to trap and eat the invaders. So which one is it going to be? This battlefield reminds me a lot about what happens in the brain after a stroke. When stroke happens, the protective layers of the brain become leaky, and that allows for the passage of cells such as BAMs into the brain. The brain-associated macrophages on arteries are much like the crocodiles in the moat. They're able to cross into the brain and neutralize invaders, but they also harness the potential to turn on their master. My work so far shows that the numbers of BAMs in the brain increase after stroke. So we know that they're responding to the insult, but what are their intentions? For my project, I'm going to be injecting a drug into the brain to remove the BAMs and to explore the changes in brain circulation after stroke. This is much like not having the crocodiles in the moat in the first place and dealing with invaders on your own. I hear you asking, how would that help stroke patients? Well, if I find out that by removing the BAMs from the brain, that we have better outcomes after stroke, well, we have a reason to believe that by nurturing those cells in the brain after stroke, we can help people like my friend's mum on their road to recovery after stroke.